Sawa. Karibuni sana.
The nightmare begins from the corner of the nation. Painful cries, thrilling screams.
Piga makofi pale. Angalia picha. Usiwe na haraka, angalia picha pale. Yes, and Sanigia County Commissioner. Angalia camera. Smile. If you are the winner, you need to smile. And then County Commissioner. Now, I think we can have a people.
They will be taking a good photo. Right. That is a good photo. And we are also requested St. Zephas to be around so that cool music, they have to grace this. So that we are all somewhere.
Okay, that's okay. Let's.
Okay, ni gani wanataka? Wale wasana wawili. Makofi kwa hiyo wanapata medal. Hiyo medila ingine, pikia hiyo medila simu, medila. Medals, gold medals, those trophies. Angalia kamera. Na hiyo hataenda nayo. Mimi atamnunulia alamu anaweka karimu alafu bima inaingia. So wewe lazima pia ununulie mchana wako sanitary pad. Kwa nini atanunua alafu ana demand? Na can you know it? Na sanitary pad hii part hapa kwa siku kuu ya ukimwi duniani. Kwa kweli na kwa kweli mtu mwenyewe ameongoza hiyo na director pia yuko pale. Mambo.
So it's always your name.
Good afternoon. My name is Steve Kadhaka. I work for National Syndemic Diseases Control Council and as a regional coordinator. I'm based here in Kisumu. And today we are gathered here at this sports ground to commemorate 2024 World AIDS Day. And our main focus today is we are focusing on men and boys, because as a country we have seen that if we are going to address issues, especially issues on HIV among young people, issues on gender-based violence, we have to talk to men. Many perpetrators of GBV are men, and we have been seeing all over in the media houses the increase of femicide in our country. So many girls and women are being killed, and most of the people who are doing this are men. So today we are actually addressing all these issues. We call it triple threat. When we talk about triple threat, is the issue of new HIV infections, which is actually affecting our young people. Number two, we are talking about gender-based violence, and then number three, we are talking about teenage pregnancies. So today, for instance, Kisumu County is leading in terms of the number of men and boys living with HIV in Kenya. HIV burden is about over 50,000 men and boys are living with HIV in Kisumu. So it's leading in all the 47 counties of Kenya. And while we're talking to these men, we are telling men, hey, it's the high time you go and check your health status. Please go for HIV test. Most men don't test for HIV. They are proxy testers. They wait for their wives to go to the clinic, ANC clinic, and then they wait in the evening when they see the mood is good in the house. Then ndio wanauliza, mambo iko vipi? Mke akisema mambo iko sawa, you see a man jumping and saying, and then I'm negative. But they forget that actually there can be discordant couples. So we are talking about that. Number two, we are telling men, go and get to know your blood sugar levels. Go and know your blood pressure level. Most men don't go to hospital until they are very sick and at the end of their illness. Go and test even for prostate cancer. Any man who is above 35 years, we recommend that they go for that test. You do it just once a year. So that's what we are talking about. We are also talking and encouraging men. It's high time we become our sister's keeper and we stop this menace of teenage pregnancy. Every teenage pregnancy is a crime. And we are seeing an upsurge of girls dropping out of school because of teenage pregnancies. And so we are telling men, hey, we have to take care of this. If you're involved in teenage pregnancy, we'll make sure that we bring all these men who are responsible to book, because teenage pregnancy is a crime. And so that's what we are focusing on today. We are also addressing other issues that affect men, like drugs and substance use. We know in Kenya, the largest percentage of people who are using alcohol are men. Men are 5 times more likely to be using alcohol than women. The other substance that is being commonly used is tobacco, mostly through cigarette. And you know, when you smoke and you use tobacco, it has negative effects on your body. And so most of all these indicators, especially on drug use, are men. Those who are using bangi, right? They are men. More men are using bangi than women. And so all these issues, when you smoke all these things, when you're intoxicated, most people become very violent. They are actually, drug use and crime and violence are related. And so we are encouraging anyone who is addicted, in case you are addicted, you want to stop using all these drugs, we can give you referral so that you can go and get helped. And then of course, we are also saying that men, you need to join women in fighting HIV. HIV involves 2 genders. So it's not just an issue of men, but it involves 2 genders, that is women and men. And so here in Kisumu, we are really encouraging everyone to take care of their health. Yes, sir.
Yeah, thank you very much. My name is Frederick Olwach, Director for Public Health and Sanitation, Kisumu County. I'm delighted to be here today, and we are gathered here to celebrate World AIDS Day 2024. As you know that we celebrate this every year to commemorate those we've lost from HIV/AIDS, also to celebrate those living with HIV/AIDS, and also to celebrate the gains that we've made since the first case was discovered in Kenya in 1984, and today marks 40 years since that happened. We are very happy as Kisumu County that we have been able to put more than 128,000 people on drugs and care in Kisumu County, of which you can hear that more than 50,000 are males, and we appreciate this because they are living because of good HIV care that we are offering in Kisumu County. That's why we have that high number on care. We also appreciate that we have put in young people and adolescent health, and also young people with HIV, living with HIV, on care. I think this is also a great achievement for us. What we are looking forward to is also to make sure that we are enrolling more men, screening more men and enrolling more men into HIV care. And I think we are having great, we have information that the boys and men are still not into care. They're not being screened in time. This is because of poor health-seeking behavior of men and even young boys. And now for this year, the theme is to make sure that we bring them in, and also to eliminate HIV by 2030, and of course also HIV in children by 2027. So I know the challenges we have now, and the issue is about triple threats, and we are talking about teenage pregnancy, and this is we are making sure that we do everything possible, engage the youth through town hall services. We have youth-friendly centers in all our healthcare hospitals within Kisumu County. And of course, we are also having sports and social services that we incorporate our HIV/AIDS screening and screening activities. So I think on triple threat, whether teenage pregnancy. We are working with all our partners. We have CEB, we have other private facilities, and of course other partners that we are working with, including the national government. We have the Bwana County Commissioner here with us because we are following up on these teenage pregnancies and making sure that those who are impregnating young girls under 18 are taken to courts, arrested and taken to courts. We have sexual gender-based violence, which is still also very common. All perpetrators also to taken to book account, and then of course we also have high HIV among the young people, young adolescents and the young people, still very high, 15 to 25, still very high, more than 20%. So I think we are just trying to engage, getting community engagement, community sensitization, and of course public engagement at all those social meetings, sports, incorporating sports, the schools, to make sure that we reach out to every young person in Kisumu County so that we can bring this down. We continue with our preventive activities through our different partners and programs, issuing of pre-exposure prophylaxis, post-exposure prophylaxis, and of course more so even PrEP in discordant couples. Like you were saying, there are partners who are living, one is positive, HIV positive, one is HIV negative. So in that case we put them on PrEP. We also give other health education and also preventive measures like the distribution of condoms, so that people make use of condoms and accurately, so that we don't get new infections. But we also have to appreciate the strides we've made. In 2013 we were getting more than 12,643 people getting HIV. Today, if you look at the last 1 year, we only had 1,730 people getting HIV in 2023. We also look into their deaths. By 2013, we had more than 3,901 dying of HIV. Today, in the last 1 year, we're only getting 1,761 people dying of AIDS. Even though there's a big stride, but 1,761 people dying of AIDS is still very, very many. So I think we are calling for people, let us go for screening, let us go for testing, let us start our HIV care earlier now, so that we don't end up getting complications and us dying of having HIV mortalities, when we can prevent this by early screening and also early treatment. The other thing is also the drug and substance abuse. We are having methadone center at UTRH. We are having tobacco cessation centers in different health facilities, including Migosi, where we are trying to rehabilitate those who are drug addicts to normal to their normal life or near normal life. So I think we are very much appreciative, and working together with our partners, we are hoping that we are going to end the issue of HIV/AIDS, new infections, and also the issue of triple threat. Otherwise, I thank you.
Thank you. My name is Benson Paramorijo, County Commissioner Kisumu. So mine is just to appeal for all our members of the public to change their behaviors, because we know the disease is still with us. So this idea of trivializing HIV as homa too, some people say it's just a normal cough. It's not true. The disease is still with us. No cure has been found yet. So we request all our people to behave well, behave responsibly, so that we stop further spread of the disease. Because the rate at which young persons are being infected is really worrying. We know there are even those who are born with the disease. And I think normally as we file returns every month of all HIV-related deaths, so that we track and see how many people we are losing to the disease. So mine is just to request that we change our behaviors, because we could not continue losing lives just because of this disease. And the persons who do acts of rape, just want to say we ensure all these people are arrested and charged, because you rape somebody and probably you infect him or her with HIV and AIDS, then that is like murder. So it's a serious offense. Others also believe that you sleep with a young child, you get cured. So again, we want to explode all these myths which mislead our people. So I think Sangao will continue advocating for, again, people to be safe against HIV and AIDS. We ensure there are no more disco matangas, because I think it is in these disco matangas that people behave very responsibly, and in such circumstances many people get infected. We also want to conduct raids. Of course, we have been conducting them, and we have been filing returns daily against illicit brews and other substances. So we want to intensify these raids, because I think it is such social places that people engage in responsible behavior and they get infected and spread the disease further. Thank you.
Bisera. I'm the program director for CEB that supports Kisumu County. We work under the Department of Health, and our role is to prevent as well as manage HIV infections. On this day, we are really grateful that we were participants in this race to ending HIV and AIDS in Kisumu County. And in this race, we really want to observe the fact that we want to eliminate all discrimination and stigma against HIV, and we also want to involve the men, because we cannot end HIV AIDS unless everyone is on board, and we want men to come on board to find out their status. If they are negative, we will be able to give them prevention services. If they are positive, they will be able to be put on high standard care, because we have guidelines in Kenya. We have free medication that is of high quality, and these clients will be able to receive that and live good lives. For the clients that are already infected, we are providing care, and we really want to race towards sustaining this care, because it has been proven that taking ARVs very well, and someone can live a quality life, just full potential as everyone else, infected or not infected. They live to their full potential. So our role is here to work with the County Department of Health to make sure that everyone is able to access services free of charge. Everyone who is infected is able to access care, and everyone is able to live fully and without fear or discrimination because of their status. Thank you so much.